Good afternoon, everyone. Welcome. Thank you so much for joining us today. My name is Karen Bell, and I'm an Associate Director for Partners for Advancing Health Equity, or P4HE. We are based at the Tulane University School of Public Health and Tropical Medicine, and we are supported by a grant from the Robert Wood Johnson Foundation. We are a national research learning collaborative that aims to bring together various sectors, including government, academia, civil society, philanthropy, and the private sector. We do this to harmonize efforts towards health equity and promote actionable solutions. One of the ways we do this is by providing interactive spaces for activities like today's webinar on building partnerships for health equity advocacy. Presented in collaboration with Community Campus Partnerships for Health, we are bringing voices from multiple sectors in an effort to learn about their experiences in creating sustainable partnerships. For us, that means we want to learn about their successes and their challenges, and identify critical values and approaches to building effective partnerships to actualize our visions of health equity. Building on the principle of community partnerships being key to health equity, we like to start by asking you a question that will help us level set today's webinar. For that, we will be using Mentimeter, which you can access by scanning the QR code on your screen or by going to www.menti.com on your browser or mobile device and entering the code 21549816. So again, if you've done this with us before, if you've attended any of our webinars, we love using Mentimeter. And so I'm going to do it with you. I'm just going to log into menti.com. It's pretty straightforward. Type in the code, or if you are more advanced, you might have just looked at the QR code on your screen. So I hit submit, put in the code, and you can do a little thumbs up to let us know you're there. It works for me, and I hope it works for you. Great, I see lots of thumbs up. So let's go to the question that we have for you all to help us sort of level set. How do you define community? This is seemingly a simple question, but I think that we will find a lot of responses. So you can put in your responses to how do you define community? And you have a couple of options. You can put in multiple answers. If you want, I'm putting in mine. Let's see what they look like. Okay. Seems like I thought we would see different responses. Neighbors, caring, values, oh, they're moving. Support is in the middle, so I can say that one. Safety, yes. Place-based, I hear a lot of that from students, that it depends on where you are. A lot of people think about their neighborhood. Love, that actually was one of my responses. Family. Belonging, definitely. Diverse, partners, that's good. That's part of our mission at P4HE and our panel today. So that makes a lot of sense that we are thinking about community in terms of partnership. Okay, I'm seeing a lot of responses that are moving. We have 90 answers. So I think that tells us a lot about how we might think about these things slightly differently, but might have some clear things that matter. So in the middle, we have love, which is something that we don't always think about in the health equity space, belonging, family, support, shared values, probably, and then safety. So I think what we're trying to do here is help us to expand our understanding of community, but also sort of drill down, because I think the concepts of community are what we are basing partnership on. So thank you for responding to that. We have another question for you, that you can also respond to on Mentimeter. So keep your phones or your web browsers open. We can go to the next slide to ask the next question. And that next question is, why should we value partnerships in health equity work? Why should we value partnerships in health equity work? So we're actually going to have our first panelist answer that question as well. So while you share your thoughts, I would like to invite in our co-host for this webinar, Al Richmond. Al Richmond is Executive Director at Community Campus Partnerships for Health and also the chair of P4AG's National Advisory Committee. So welcome and thank you for being here. I think given your work, your experiences, we like to ask you the same question, why should we value partnerships in health equity work?
Well, thanks, Karen. It's really a pleasure to be here today. And I don't know that I have much more to add, actually, than what's being provided today or this afternoon. I liked the first answer, quite frankly, and that is it cannot be done alone. In particular, when we think about the work of advancing health equity, oftentimes we know what we are against, or we know what we are not in favor of. And I think that there's consensus, I'm certain there is, that we are all, we are for and agree that health equity is important, that it's a priority for us in our work. But the work of achieving health equity is really difficult. It's not impossible, and it's challenging. And quite frankly, I think that what you have in front of you, the answers that people are providing, is the first one is really powerful, and that is that it cannot be done alone. It really does require collaborations, partnerships, working together through what we call partnerships. We at CCPH, we are Community Campus Partnerships for Health. It's who we are, it's in our name, and it's quite frankly what we do. Every single day, we are really about the work of building, for us, we use the term authentic partnerships, which we define as partnerships that really serve to create win-wins for all of the partners that are a part of the work. And so I think that all of these answers here really do help us to hone in on our understanding of the importance of partnerships, the power of partnerships. We have answers that say the best use of financial resources. The reality is that the work of building and advancing health equity is very costly. Not one organization has all of the money and all the resources to be able to do that. And so therefore we must work together to do that. It's about really kind of coalescing around the broader issue of health equity and working in through partnerships to achieve a mutual goal of equity in health, which impacts every phase of our lives as a nation and really as a global society.
Thank you for obviously that response. I think one of the things, well, actually, I'm probably going to sound like my dad here, and that we talk about these concepts of equity and partnership, but it's really more than a notion. It's not just, some canned idea about doing something good. What we really want to get into in this webinar is how to do it and what are those underlying values, underlying approaches that actually make partnership happen. So the next question I want to ask is about how do you do partnership for advancing health equity, which, I think I just dropped the name in right there of our organization, but how do you do partnerships for advancing health equity across sectors? Because just like we've mentioned, we all have different financial resources, different experiences, which is something that came up on the screen and people's responses. How do we do that across sectors?
Yeah. So Karen, I want to take a kind of shift that conversation a little bit to really acknowledge this issue of power imbalance, because I think that how we do it, one of the things that we have to do that's really important is that we have to acknowledge that there is ever present a power imbalance in most partnerships. In particular, when we move outside of our sectors, or I'm a nonprofit, leader, community-based organizational leader, and I'm interfacing with the federal government, I'm interfacing with academics, I'm interfacing on a regular basis in partnerships with many different types of sectors and across sectors. And the work that we do through for P4He is just that, right? It is about across or multi-sectoral approaches. And I can guarantee you that when we reach outside of any sector, and even within sectors, there's a power imbalance that we all have to acknowledge. It's that topic that sometimes we shy away from, but in some ways it's embedded in this idea of the golden rule, and that is that he who has the goal makes the rules. So oftentimes as leaders of a nonprofit or community-based organization, we're sitting at the table with individuals who are funders. And again, inherent in that is a power imbalance. So the work of building a partnerships really starts with an acknowledgement of that, number one, and number two, giving intentionality to try and mitigate that power imbalance such that everyone's voice is valued. If you think about the old adage, if you're not at the table, then you're on the menu. Well, then the way I think about it is that we want to make sure that when people are at the table, it's maybe a round table. It's not a square table. There's not a head of the table. There's not a back part of the table. We're in a round table where all partners are equal. And in order to do that, we have to recognize that inequity and power imbalances are present and then work towards mitigating that. And quite frankly, that oftentimes takes a long time to do that, right? And that might take weeks, months, and even years. The best of partnerships start with the recognition of it and then move towards mitigating the power imbalance that's ever present in all partnerships.
Yeah, I really appreciate you saying that the power imbalance is there. I think, sometimes we'll go into these partnerships, particularly, academics who work with communities and say, hey, we're working together. So there's no imbalance, but it's always there and it can show up in different ways. So actually doing that work, I really appreciate you pointing that out. I wanted to see if there was anything that you saw on the screen that you wanted to point out. Sorry if this feels like a little bit of pressure, but anything that stood out to you on the screen. I know you mentioned the first response.
Yeah, I can't scroll down. I can't see all of this, but I want to acknowledge the whole idea of lived experiences. So the question is, why should we value partnerships in health equity work? Is that oftentimes we also minimize lived experiences. And Karen, you kind of you kind of alluded to that earlier when you were talking about community-based organizations being at the table, the proverbial table with academic partners where they say, oh, yes, we're here. But oftentimes the community will sometimes defer to the academy or the academic because they have the statistical data or research around it. But what the community offers is their lived experiences. And so again, in terms of mitigating the power to me, in particular when it comes to working with community-based organizations, should be weighted towards those individuals with lived experiences. And I want to say that it's not just about this work of lived experiences. I've transcended the idea of community to include also my work with patient communities as well, and through partnerships with the Patient-Centered Outcomes Research Institute, PCORI. And so the work of PCORI to me really serves as a great model because it acknowledges that the patient voice is so important. It's center to all the work. And in fact, there's this adage that says nothing about us without us. Well, that really should resonate with all of us, that we should not pursue partnerships and we cannot advance this work without the engagement of people with the lived experience. We have to check in with them. We have to validate our work. We have to allow them to lead the work. And I said allow, because there are times when they're not even given the space or the room or allowed to lead the work, but making way, giving space, deferring to them might be other terms that we might use. But again, people with a lived experience that we're focused on. I don't care what the issue is. I don't care if it's HIV/AIDS, the built environment, diabetes, hypertension, COVID-19, long COVID, whatever health issue, whatever issue we're tackling, look in the community for people who have that experience, who in particular are disproportionately burdened, and engage them in the work.
Right. Yeah. Similar, those closest to the harm already know the solutions to their problem. It's a matter of the power and balance and the resources. So yeah, thank you so much for stating that and for providing and sharing some of your wisdom. We're going to continue the conversation by adding a couple more people in, but to the audience, please continue to share your thoughts and comments in the chat throughout today's discussion. You can also join this conversation with your questions and comments beyond this webinar or right now. You can live tweet, that's fine, but you can do so on Twitter by using the hashtag partners4HE. Okay, so let's actually welcome those additional guests. First, we have Adriana Gutierrez, who is a bilingual licensed professional counselor and supervisor in the state of Texas. And then we also have Lachelle W. Wardell, who is Population Health Director at Wake County Health and Human Services. Thank you all for joining us today. I have kind of a broad question, which I kind of chuckle because there's so many ways to answer this, and I'm really interested in hearing what you have to say about this. If you could discuss from each of your points of view, so this can be kind of a round robin, I'm not sure. If you could discuss your experiences building partnerships, particularly challenges as well as successes. So whoever wants to go first, I'm just gonna sit back along for the ride because I'm excited to hear from you all.
I can chime in if you're good.
Start, let's go.
All right. So, as Karen mentioned, I'm a bilingual therapist. And so I've worked many years with immigrant families in particular. And so we recognize that that is an at-risk population that often lives in the shadows. And we also recognize that this population tends to have multiple experiences of trauma and has high risk for PTSD, depression, anxiety, all the mental health issues that you can think of. But because they live in the shadows, they don't seek out those services. And so one of the things that my team at the Robert Wood Johnson Foundation Clinical Scholars team really worked at building was community partnerships for these at-risk populations and these populations that are hard to find. And so I think one of the successes that we had was that we found community partners that had already built trust with these groups. And that was really key for us, because even though I was bilingual and I understood the population, I was an outsider coming in. And so to come in and say, hey, I want to talk to you, they're going to say, we don't trust you. But when we found that community partner that was already working with this population, they were willing to speak to us because it was coming from a person that they already built that trust, had already built that trust with. And so I think that's a key to success. I think also one thing that was a struggle was building the trust with those key partners. And so it's kind of multiple layers of building trust, right? It's not just building trust with that population or that group you're trying to reach, but it's building trust with the community partners, because especially with immigrant families, there's a lot of risk to speak. There's a lot of risk to participate in any research or to participate even in seeking services. And so often the people that are supporting them are very cautious about letting people into their world. So that's what I have to share.
Thank you, Adriana, and I'd like to build on that. As mentioned, my name is Lachelle Wardell, and I'm the Population Health Director here at Wake County Health and Human Services. And I think, well, let me just start by saying that my whole career has been based on establishing relationships and building partnerships. Al will tell you we go way back where we were, working in the street, working in the community, going to faith-based organizations, nonprofit organizations, spending, weekends, evenings out in the community, establishing relationships. I think what I've learned over my many years of doing this, and I won't say how many years that has been, it's not quite as long as Al though. But what I will say is a lot of times we fail because we define partnerships. We give one definition for partnerships when there's a whole continuum of relationships. And when you're not clear what type of relationship you are building, you might have some missteps and be doomed to fail. What do I mean by that? One, we assume that partnerships are the answer to everything, right? There's some common myths that we have in terms of what partnerships are and the benefit of them. Sometimes we make the mistake of thinking that it's always great to have a partnership or to have a relationship. Or we think, as Al alluded to previously, that as you're entering into partnerships and relationships, that there is an equal distribution of power. And depending on the type of partnership and the type of relationship that you're establishing, that may or may not be true, nor may it be true that it has to be. Another reason we falter or fail is because of our motives for partnering. A lot of times we want to partner because the funder says you have to, and in order to get this money, that you have to establish a partnership, which is not the best reason to enter into a relationship, and it's not going to be withstanding. The other thing, another myth is that we think that if you try hard enough, it's going to be successful, and that's not always the case either. So I think the first thing we have to do is define the type of partnership and the type of relationship you're going into. It could be as simple as going from a cooperative relationship, just meaning that it's not formal, we're not interdependent, but we're just going to cooperate with each other, right? And then there's the coordination aspect of that, where we're putting more energy and being more formal into it. There's some resource sharing that goes along with that. It's a little bit more semi-formal. There may be some linked responsibility. However, that's different from collaboration. And oftentimes, when we think about partnerships, we're thinking about establishing a collaborative relationship, which really speaks to the interdependence of the organizations, that you're going in together with joint ventures, that it's more formal, that there's shared responsibility, there's shared resources, there's shared mission and goals. So I think the first thing that I've learned is we really need to start by being clear in terms of what types of partnership we're entering into, and being clear with the organizations, with the communities, with the individuals that we're forming these relationships with, so that we are not setting up undue expectations or missing the boat with each other.
That's so powerful. Thank you. I mean, I could not agree more with both of you. I want to go back though, and Lachelle alluded to this, and I think Adriana set the tone for this, that made me think about assume nothing when launching a partnership. Like, just, what she brought to mind for me is this idea that we think that maybe even because we are from the community, that they will listen to us, right? So we may speak the language, so to speak. And that's a problem, because oftentimes funders and others are looking for people in the community that look like the community. That's, oh, you're from the community, you speak the language of the community, all of that. But the danger in that, and I think that's some of the things that Lachelle is talking about, is the fact that that doesn't guarantee you success in the partnership. In fact, that may in fact create more challenges, because we may miss steps, we may assume a lot, all of that. So I think that my takeaway from this conversation so far is to assume nothing about the partnership, to look at each partnership as being unique and distinct. As someone that has lived in, my community for 30 years, and Lachelle and I, she talked about, we work together. But one of the things I recognize is that the community is ever changing, right? There are new people in this community. They have new and different perspectives through gentrification, through people shifting, moving. The churches that we worked with 25 years ago are not in existence. They're new, all things are different. So I don't want to assume anything. I think that really, maybe the key is to err on the side of caution in partnerships and start afresh. And maybe, you're building off of relationships, but you're acknowledging that this is a unique and a distinct partnership that may be different on this continuum, as Lachelle is describing, from kind of, we just need you to help us to distribute some information in the community, to we really are looking to you to really have a deep a partnership relationship through shared leadership. The other idea is sharing. I mean, that's what Lachelle talked about, is like sharing, like, have a partner that says that everything they learned about partnerships, they learned in kindergarten, right? Put it back where you got it from. Don't push, be courteous. All of those real basic kinds of things that they teach you in kindergarten, those are the same things that apply in partnerships, successful partnerships.
I think, Al, what I want to go back to is something that you said. I think another mistake that we make is when we assume that the community is all kind of, monolithic, right? Like there's just one community. And so we say we need voices at the table that represent the community. I like that level setting question that you had in terms of how you define community, because we oftentimes make the mistake that say, well, if you're Black, you speak for the entire Black community. If you are, Latino, Hispanic, then you can speak for the entire Hispanic, Latino. So we'll find one or two people that we say now represents this community, and we're going to form partnerships or be in relationship with them. And we're leaving other segments out and other sectors out, because none of our communities, are just monolithic, right? Like we're diverse within those populations. And so we have to acknowledge that and recognize that as we are forming relationships.
Yeah.
Can I jump in here? I also want to just add that, so also thinking about the recipients of the work that we're receiving and having, I think we mentioned having them at the table too, is crucial, right? Because as outsiders coming in, or somebody providing the service, or wanting to make policy change, if we're not including the people who are impacted that in the day-to-day, then that you're not really going to have the results that you're looking for, and you're not going to be able to build that trust in the partnerships that you're hoping to build, because that's going to, if you have a failed change, or a failed relationship, or a failed attempt, that sort of leaves a sour taste in the community, right? And so I think having the not just as systemic changers, that we are, but having the day-to-day people coming in and being part of those decision makings, and asking them, what services do you want? What would change mean for you? And even asking, what is community to you, right? Who are the people that you're working with that need to be involved in these decision making? To be involved in the decision making. Sometimes we kind of come in and say, this is what we're going to do, as opposed to including the whole community.
Let me jump in here, because I have been told by my boss that there are two questions in the Q&A. So I want to get to them. First, let me just say, this is like Health Equity Partnership 301. I feel like we're often stuck at 101, but y'all are giving us 301. Lachelle, I really appreciate the regionality and how you responded, because you said, here's a question, let me give you the answer. And I recognize that straight off the bat from a North Carolinian's perspective. The first question is from Crystal, and it's kind of broad. And then the next question is from James, which is more specific. So I'm going to start off with the broad question. Crystal asks, what characteristics do you value most in successful partnerships? Or otherwise, what characteristics make up a good partnership? If you could give some sort of list or a definition, how would you do that?
I guess I'll start taking a stab at that. And again, it depends on, I'll go back to the type of partnership that we are talking about. But, some of the things when I think about just overall partnerships in general, some of the characteristics that I would say, one is having your vision and relationships and being clear about what that is upfront as you're entering into this relationship. So what is the vision for the relationship? What is what kind of relationship are we entering to? And then based on that, how we're going to structure this? What are our individual responsibilities as we are going into this relationship? What are you going to do as a partner in this versus what are you expecting me to do? And let's have this open communication up front so we are clear. Also addressing where the authority and the accountability is within this relationship. So whether we're talking about a cooperation, a cooperative agreement versus a collaboration where we are forming a whole new entity together, where we're, interdependent, developing shared vision, shared values, etc. Where is the authority with that? Where's the accountability? Again, and then what are the resources and rewards? What are we getting out of it? What are there going to be shared resources within this relationship? If so, how are we sharing them? And then what are the benefits? What are the rewards for us to come together? So those are kind of the things as I'm entering into any relationship, I want to consider all of those factors and all of those pieces before we move forward.
Yeah, I think you hit it on the nail with that. I agree with everything you said. I think the only other thing I would add is shared goals. And maybe you kind of said that in an indirect way, but making sure that our mission or our goals are all aligned so that there is a clear understanding of, because I think that helps to then define the roles, defines the budget, defines the, who's responsible for what. So coming up with that shared, what is our long-term goal? Why do we even need this partnership? What is our end goal?
Aaron, I'm learning, they're schooling me, so I don't know if I have anything else. I'll just operationalize what some of that might look like. It falls under this broad category of transparency. And when I think about transparency, the first place where I think about is the budget. And both my colleagues, panelists have alluded to that. What are the resources and how will the resources be shared, all of that. The community broadly defined, I'm saying with air quotes, is really very smart. People know that people are doing what they do in large part because they get paid to do it. So, let's just be open, honest, upfront with people. And having said that, and knowing that, then being honest about compensation, being honest about what's possible in terms of compensating community partners, community-based organizations, all of that, right? And so that to me is just a higher level that's pushing the envelope. And oftentimes, again, that's a conversation that we don't want to have around money, but talking about money is really important. And when we talk about it and we're honest and we're open about it, people then know what we can do, what we can't do, what are the limitations. We all know that for NIH-funded projects, you cannot purchase meals with NIH dollars. So be upfront with people, but then work with the community to define another source to compensate them for meals when they're attending meetings. So it is about transparency, but I wanted to give that specific example.
Those were like amazing answers. Again, partnerships 301. So I'll ask this next question because I actually think you could broadly put this question in: how do you create partnerships given context that can be restrictive to partnerships for advancing health equity? But let me read it correctly. How do you build partnerships in state or local governments with policies that marginalize the already marginalized? For instance, LGBTQ plus laws and policies in states like Florida and Texas. I'm also thinking for me about like restricting DEI and CRT in university settings. What happens to someone who's Black or Hispanic or Latino, also LGBTQ plus identifying? Who do you turn to then if partnerships become limited? So I guess limited by outside forces or actually inside forces. So the context, political context that we live in.
So I'll start this one by just acknowledging intersectionality. And when Lachelle was talking about that there is no monolithic group, it's true. People are more than what they appear to be. And so I'll back into it that way, wherein we are understanding and recognizing the intersectionality that people have and the conflicts that are associated with showing up with all of that uniqueness as an individual community member. I would like to think that based on our own history of people, as a person who's been in a marginalized group, continues to be in a marginalized group, that somehow, some way, we're going to get that work done. And that this may, in fact, be a really important moment when partnerships are needed even more so now than ever before because of the full frontal attack that is on these types of issues that James raises in his question. And so I think that that's why we have to be in partnerships. And then what I think about is being in partnerships globally. I mean, across the country, in particular, CCPH is a national, international organization. I would imagine that as these more restrictive kinds of laws and policies are put in place, then we have to grow our partnerships, move out of our state and even our region to seek support and help from others. So that if we have been limited by federal laws that restrict federal dollars, then we look to state dollars, city dollars, philanthropy, corporate dollars, all of that. We have to be creative around how to kind of retrofit this work and keep this work moving in spite of the ever-present attacks that have been launched against this very important work.
Al, I'm glad that you said that, because I work for government, right? I work for a county government organization, and we are restricted. There are certain things that we can't do. There's certain things that we're not allowed to touch. For instance, sex education in the schools. In Wake County, that's not allowed. We can't talk about it. You are very limited and restricted in what you can say. So a couple of ways that we approach things like that is, again, to partner with those nonprofits, those grassroots organizations who don't have the restrictions to be able, and then I can work to equip them to be able to address the community issues. So I might not be able to do it as a government employee in the way that I would like. However, I can then build capacity within those community structures and those community organizations who are less restrictive to be able to carry out that work. The other thing that I try to do is to work internally. So to start having those conversations within the systems to be able, and I have to use data. What works within our organization to change policies and practices is to show through data the impact that those policies and practices are having, and to really work internally. And it's a slow process. Not only am I having to work externally with my community partners, but now I'm also having to advocate and work to work on changing those policies, practices, and procedures that are limiting and that are marginalizing communities. My role as population health director with a focus on health equity is to understand that the structural Racism, the systems are a large part of why we continue to see these disparities and disproportionalities out in our communities. And so until we can change that, we're not going to have long-term lasting impact in the community. So I can work with community partners to help them build their capacity. Also, particularly with a lot of our faith-based grassroots, boots on the ground organizations, to help equip them around advocacy, to train them for how do you go and speak before the legislature? How do you go and attend those school board meetings and those board of commissioners meetings to speak up for the needs in your community? And as a partner, I have to be a silent partner in that role, but I can equip you so that you can be the vocal partner to change those policies, practices, laws, and procedures.
Now that's 301 right there.
Yeah.
Right. That's it.
I think that's grad school. Yeah. I think
No, that is absolutely capacity building. What Lachelle has laid out, and I want Adriana to weigh in on that. Is that's sometimes what our work is. That's why partnerships are important, because everyone has a role to play in this work. And sometimes, you know, I think about the civil rights movement in this country. As one example, everyone wasn't on the front line. Some people stayed back behind. Some people fried chicken and packed meals and prayed and sang. I have a colleague in Hawaii, Maylene Isaacs, and she phrases it like this. She's like, if you can't get on the front line, you just stay home and cook rice. You know, I was like, wow, I had never heard that. I was like, that's a powerful way to put it. Like, but everyone in the partnership has a role to play. So if you're afraid and you can't be on the front line, then you just stay home and cook rice.
Mm-hmm. I love that.
Yeah, lunchtime, Al.
Yeah. What comes to mind for you?
So one of the things I was thinking about, so I'm also a PhD student, and made me think about kind of starting from the bottom, right? And kind of really working to teach advocacy in our educational system at the master's level, doctoral level, because that's where your change makers kind of start to develop this idea of like, oh, I can do something more than, right? I can be more than just whatever I'm studying. And so that's kind of the part that resonated with me is, you know, I'm an older grad student. I'm most of my cohort is in their 20s, and I'm way far from my 20s. And so I often talk to them about, hey, this is how you can be a voice for counselors. This is how we can change policy. Let's go to advocacy day. So I'm, you know, kind of being that mentor for the younger generation to teach them how to do these things, because every little thing that we do, whether it's cooking the rice or whether it's being on the front line, is crucial to making these changes for all of these at-risk populations that may not have a voice.
that resonates with me as well as Professor Karen. I wanted to ask a quick question to Adriana because I am thinking of the time. And also I wanted to ask you all about your experiences with COVID-19, the COVID-19 pandemic. But quickly, how do you make decisions regarding compensation such that you're not being coercive or emphasizing the power differential that we talked about? So this is kind of like a practical question. So maybe I asked Adriana, but anybody, if you have like just a quick response.
So just to make sure I understand the question in regards to working with at-risk populations, like how do we refrain from being coercive with them? Is that kind of what you're asking? Yeah. So I think with anything that you do, there's informed consent, there's transparency, this is the why behind why we're here or why we want to speak to you. With the research projects that I've done with immigrant families, we have given them significant compensation, from dollars to meals to things that we know that they probably need, and then we also have so I think this is the piece in building partnerships. It's not just about like as a researcher gathering your data and saying, okay, thanks, see ya, never see you again. It's about building, doing your research and then saying, what other resources do you need? What else can we provide for you? So that's kind of when I can put on my counselor hat and switch over from my counselor to my researcher hat. But I think the biggest thing is transparency and informed consent, and recognizing that people's time, all people's time is valuable, and that we can't just go in and assume that because we're more quote unquote knowledgeable, or we're the outsider coming in, that our time is more valuable than theirs, right? We have to recognize that often their time is more valuable than ours, because if they're taking time to speak to you, or they're taking time out of their day, at least I can speak for the immigrants that I've worked with. A lot of them work 3-4 jobs, so if they're coming out and missing a day of work, that's a significant amount of income that they're coming to speak to you, so that you can gather data or you can get information. So really, really making sure that you're being fair and equitable and asking them what they need. I think also looking at the cultural piece is really important, because as Latinos in general, we often, we're very humilde or humble, right? And so they won't ask for anything. And so you kind of have to just assume and bring stuff. My full-time job is I'm the chief operating officer at a local nonprofit that provides counseling services to youth and families. And one of the things that we're really working to build this year is a parent advisory committee. And we already know that we want to make sure we have food available for them because they're taking time out of their day to come meet with us. We also, need to recognize that there may be other sorts of compensation that we need to have for them. And so those are things that we build in our budget. Those are things that we're building in as we build these relationships or build these practices, is thinking through all of those things.
So you actually said a lot in that response. One thing I do want to point out is that we sort of synthesize these webinars. So on our website sometime after this, but we'll have sort of key points and things that will be synthesized from this. And we also record this, so you can go back, which I will probably have to go back myself to get all of this master's level information. I want to highlight something that Dr. Neighbor said, and he just pointing out the importance of political advocacy. I know that we use terms like capacity building, but really we can also use terms like organizing, which are, some of those efforts to get us forward. But I want to close sort of in a weird way, but you'll see if there is one lesson about partnerships that you have learned through the COVID-19 pandemic, either when it first started, a year ago, or even now, if there's anything that you have learned that you can share with our audience, a lesson about partnership, that would be amazing to sort of just round us out, because I think we've discussed a whole lot here. And I think contextualizing it in something that has affected all of us would be a good way to close out.
I'll start. People do care about their health. Black, brown, poor, people in public housing, assisted living facilities, wherever. People do care about their health, and they care about the health of their community.
I definitely agree with that, Al. I think the other thing, the lesson that became clear for me during COVID as the person responsible for equitable vaccine distribution in Wake County, is that relationships matter. You cannot show up in a community and expect them to trust you and participate in your programs, in your work, and you haven't done the work. One of the things that we heard clearly during COVID, when we saw the big disparities and the big gap in terms of who was accessing vaccine and who was getting COVID at higher rates and who was dying from COVID at higher rates, is that, and I'm out trying to get folks vaccinated and bringing vaccines out to the community, and a community saying, well, where have y'all been? Now you care about us now that COVID is here, but we've been suffering from diabetes. We've been suffering from cancer. We haven't had homes to live in. You know, we've got crime in our neighborhood and didn't see you out there then. So now, because you want us to do something, now you want to show up and we don't trust you. So I think, not that, you know, I didn't know this already, but relationships matter. And when we're talking about partnerships, what we're really talking about are relationships. And relationships take time. It's not Monday through Friday, 9 to 5. It is given of your time. It is when you're not at work and you're still out in the community and you're still participating in the events that the community puts on that you had nothing to do with, but you're still there to show up and support. It's going to worship services on Sunday morning when you really want to sleep in or spend time with your family. It's being out there in the community on Saturday afternoons, on Friday nights. It is, you know, in one community, it is helping them do going out during community watch at midnight because there are drug houses in the community they're trying to close down. It was, and I've been doing this work for over 30 years now. It has taken that long for folks when I call that they automatically pick up the phone, because I didn't just show up yesterday. I didn't just show up because I needed something, but I've worshiped at their churches. I've sung at their churches. I've been at the funerals. My son has been to the schools. You know, we have been embedded and engaged, and we have shown up when we weren't at work. That is what I really learned, and it would hit harder during COVID, is community coming back and saying, you can't just show up because you want something and expect us to partner with you. Relationships matter.
So just quickly, I was just going to say creativity. So my role is more mental health. And what we found was that mental health issues actually, they never went away and they got worse after during COVID and post-COVID. And still having to be able to provide good services to clients was really important. And so creativity was really one of the biggest things that we struggled with, but we were able to find a way to still meet the needs of our clients. So that's one of the things that we learned.
Thank you. From creativity to relationships mattering, all of that rings true and is correct and ethical. And that's what we are trying to bring about with this webinar. So we really thank you for your expertise and for sharing this time with us. And for sharing your wisdom with us. I would say my mind is blown, but there's so much in there that there's not enough space for it to be blown. So thank you so much to each and every one of our panelists, particularly our co-host and chair of our National Advisory Committee, Al Richmond. Thank you so much. We appreciate you all. Now, as we close this webinar, we'd like to learn from you about how practical and applicable to your work the conversations we've had today are. So we'd like to invite you to fill out a short survey that you should be able to access through a link in the chat or by scanning the QR code that you're seeing on your screen. With that, we conclude our session today and invite you to join us for our upcoming activities. On Wednesday, June 28th, we begin our newest workshop sprint. It's titled Research Synthesis for Evidence-Based Health Policy. Registration is still open, so you can sign up for that. And then also on Tuesday, July 18th, you can join us for our upcoming webinar titled Censoring Global and Indigenous Solutions for Health Equity. So again, the link for the survey is in the chat. If you had a chance, you could have used the QR code, but the QR codes on your screen are for our upcoming workshop and webinar. For more information about our upcoming activities and just for information about P4HE, you can go to our website, partnersforhealthequity.org. Follow us on social media and help us spread the word by sharing our content that most interests you and your work. See you all soon.